To highlight is that we don't use the clock to swing in front of others.
You know those cartoon characters when there's squiggly lines everywhere? Therapists kind of help straightening it out, right? Would you agree with that?
So these are like tips, make sure that you know your stuff, do a little bit of revision before you go into your interview.
I think you gave a very amazing answer because you actually checked out all the boxes of questions we wanted to ask.
Hello everyone, welcome back to our another episode of HPS's podcast. So I think today's topic is going to be pretty interesting. Yeah, I think it's a topic that a lot of people these days are getting quite interested about. So today we will be talking about clinical psychology, a field that a lot of people are starting to becoming very curious about, in terms of what is it? What do clinical psychologists actually do? How the Masters of Clinical Psychology courses actually like? So hopefully today this podcast will give the public a better understanding of what we actually do, what can you expect from it, and what kind of misconceptions sort of revolve around this field a lot. And another big aim for our podcast is that, maybe we'll also want to give a bit more clarity for those who are actually thinking to come into the Masters of Clinical Psychology course in terms of what to expect, get a better understanding of what programs look for, when we are selecting the candidates. So, hopefully our podcast today can, inform the audience a lot more about what this field is actually like. So before we really get into the depth of our podcast, we'll start off with our usual round of introductions. So hi everyone, my name is Sandra and this is...
My name is Hafiz.
And you can introduce
I
yourself.
am Dr. Lim Hooi Shan, the Program Director from Taylor's University for Master of Clinical Psychology Program.
And Sandra and I will be your hosts for today, and we will be the clinical psychologist trainees of Taylor's HPS Heart Psychology Services here at Taylor's University, Malaysia. I think now we can begin with our questions, yeah? So just as like an introduction question, a very general question, right? If someone is listening to this podcast and thinking maybe I want to be a clinical psychologist, which I think we can agree now, a lot of people today do want to, right?
Yeah.
And maybe a lot of people also don't really know what it means to be a clinical psychologist. What would you want them to understand by the end of this episode?
I think a lot of Bachelor of Psychology students, it is always number one choice of them if they want to pursue their study. We have did a survey ourselves as well. Is clinical psychology, proud to say, is always the number one choice. But I think you are right. Not everyone are ready or even clear because it looks fancy name, it looks bombastic, and because most people are choosing these professions, and people are thinking that this is like a very hot area to pursue. But when they don't understand the field, that's where some of them couldn't really resiliently go through the program until the end because they are not prepared with the thing that come along. So if I want to summarize what is clinical psychology, it is a specialized profession after someone has a Bachelor of Psychology foundation. It is another specialized level where they are focusing on psychological disorder, psychological pathology. And this area that we are contributing in is from the angle of diagnosing them with those disorders, coming up with treatment, doing assessment, and of course another important thing is prevention. So sometimes people thought that we hope only people who got ill come to us. No, I think we are also doing the part on mental health awareness, things to actually prevent them to actually getting the disorder itself. So these are all the areas that covered by clinical psychologists.
I think that's actually a really great summary of what everything in clinical psychology is, because I think even for both of us we can agree a lot of people, especially with clinical psychology being a new thing here in Malaysia, if our society and the stigma still, there's always confusion of what actually is a clinical psychologist, and maybe the confusion of what you mentioned. A lot of students want to pursue clinical psychology, but they might not actually understand what it is, and then when they get into it, it might be a little bit overwhelming because it's not what they expected. Which is hopefully this podcast will help clear out what exactly it is. What exactly is clinical psychology, what exactly it is to become a clinical psychologist, and what to expect in the program. Sure. So I think that sets the stage really great, so thank you for that. And I think you did cover this just now a little bit, but more just to go through the segment again. How would you explain clinical psychology in simple words, especially not just for students, but also for parents as well, because this would be their best interest as well, and just a general public of what clinical psychology really is. Yeah.
Okay, I think the wording that I used just now, it is a specialized field after the person have gotten the Bachelor of Psychology foundations and focusing purely on psychopathology. And so it involves all the areas that we mentioned just now. It involves treating, it involves assessing, it involves diagnosing, it involves also prevention.
I think it's a very good summary, very simple. So hopefully that gives a very brief understanding of what clinical psychology actually is. So I think another question that a lot of people have, there's clinical psychology, then there's also very similar things like counseling, psychiatry, or even social work. So I think these fall under like a very like an umbrella under mental health work, but there's still a lot of, perhaps to say, misunderstanding about what actually are the differences between these roles. So perhaps could you help us better understand, how does clinical psychology differ from counseling, psychiatry, social work in terms of, the training and the roles?
Okay, so I think start from the training. If it is counselors, based on the Board of Counselor Malaysia, the person need to have a minimum of bachelor. I think the diploma is also allowed, depending on a certain program, to become a registered and licensed counselor. So the minimum training is at least the bachelor level is 4 years. Some program maybe they can squeeze in 2 years, but normally it's at least a 4 years program. But another more common route is actually when you completed your bachelor in any other field and you take a master for 2 years to take master of counseling program, then you can also graduate and register and license as a counselor under the Board of Counselor. And when it comes to clinical psychology, it has to be Bachelor of Psychology degree, 3 to 4 years depending on the university, and then another 2 years in Malaysia. Then you can actually get under the registration and also a practicing certificate under the Malaysian Allied Health Professions Council. And when it comes to psychiatry, you need 5 years of MBBS degree in the medical program, 2 years of housemanship, and then another 3 years for specialized training under psychiatry in order to become a psychiatrist. And when it comes to social work, in Malaysia, there's no clear-cut minimum requirement needed. But if we are looking into the university offering module, it's normally in a bachelor level. For example, UKM is offering that. So it's a 3-year program, Bachelor in Social Work. There are some universities who offer master also, but not as common in Malaysia, Master of Social Works. I don't think they have a prerequisite also that their bachelor degree has to be from certain field. So that is the requirement for them for the program, for the different professions. When it comes to what they can do, if it is counseling, they are handling non-clinical cases. So any cases that is not diagnosed with or severe mental health situations is all under them. Day-to-day stresses, marital conflict, interpersonal issues. So those areas are under the counseling team. And then we have the more severe issues which touches on clinical issues, all the disorders, schizophrenia, autism, ADHD, anxiety, depression, all these are under clinical psychology and psychiatry. So they share that same area. For social work, they don't focus on what disorder per se, is whether the individual require any assistance from the social welfare angle. So if we are looking into the social welfare department from Malaysia, any cases that come to them can be on domestic violence. It can be from child abuse, all sorts of abuse, physical maltreatment, sexual. So all those things are still under the social welfare department to manage. We also have financial aids issues. So if anyone who are in poverty and they are, especially if they are OKU, also they can request some financial assistance from social welfare. That's the main role normally handled by the social workers. So these are the different areas that they handle. When it comes to another part, which is on diagnosing, only psychiatrists and clinical psychologists are allowed to diagnose someone with a disorder. So there is an argument from counseling program. They have a Master of Counseling, and in bracket, clinical mental health is another hit also that people thought is a replacement or maybe equivalency to clinical psychology master. It's not. The reason why they are taught with those clinical mental health area is because if you look into some depression situations, they are not as severe that they need up to clinical psychologists. And you need to know also the populations of this group may grow bigger, and we need counselors to also be able to support some of the more minor cases. So that's why they have that part of the training. And another important thing that they cover that in the program is also to help them to know that, oh, actually this case is already quite severe. They have to refer the client to the psychiatrist or clinical psychologist to handle further. But it's not to equip them knowing how to handle those more complicated disorder related kind of situation. Because you need to understand, when I described the counseling qualification earlier, they are not required to have a basic bachelor like how it implies to other programs. So they can come from maybe in engineering, accounting, and they can join the program. Imagine it's only a 2 years master. They don't have the adequate knowledge to even know abnormal psychology like how Bachelor of Psychology students have went through. They can't really even know that this client is already severe enough that they're supposed to be sent to be referred out. So which is why I think the existence of those programs is to cater this gap, but not as a replacement for clinical psychologists. Other part is assessment differences. Only clinical psychologists and counselors do psychological assessment. Psychiatrists doesn't do psychological assessment, but they do get trained in doing a more brief version. For example, simple MMSE, they still will be trained to do it. Like they know how to read DARS, BAI, BDI, those things they still know. But when it comes to a full-fledged of IQ test, it's only clinical psychologists who has the training to conduct that. A more complicated assessment like you all have went through before, like MMPI, those things are also only trained under clinical psychology program. And even when it comes to the publisher for all the psychological assessment, Pearson's and all those big companies, they only recognize CP as the one who are allowed to operate or conduct, administer category C assessment, which is IQ test, and not even psychiatrists don't get this rights to conduct the assessment. And for counselors, theirs is maximum up to category B. They can carry out personality tests. They can carry out career assessment tests is their strength, because in MQ, based on the Board of Counselors assignment or the program standard, they must train the student with career-related training. So career development theories, career assessment must be embedded within their training. So they definitely need to know this. So that's why this is their strength instead when it comes to that. So they can carry out up to category B type of assessment. When it comes to psychiatrists, as I mentioned, they don't do this assessment, but they carry out physical examination, because we need to also understand that sometimes some clients, they have disorder, not really because of mental health related issues. Sometimes when they have this big lump on their neck, and that would cause them to have uncontrolled anxiety, emotional outbursts, anger outbursts quite frequently, but it was not a disorder. Once they treat these conditions and all, they actually go back to normal. So these things are not trained by CP training. We can't really differentiate that so much, which is why we need psychiatrists to intervene, to check all this, to rule out all the medical possibility that cause the persons to have a sudden switch of personality or even on their other clinical related conditions. So they carry out all those tests for that purpose. For social worker, they are not really trained in specific tests per se, but they normally would have a more hands-on approach where they would talk to the person who needed the support directly and then see what they can offer. Normally because they are funded by the government, so monetary aids, sometimes it could be in the form of small little food package or whatnot that they are giving out, things like that is under them.
Yeah, I think there was a very, very comprehensive understanding on, these force fields that we talk about. I think another thing that I would like to add on as well, when it comes to the comparison between clinical psychology and psychiatry, is that I feel that another common misconception that a lot of people have also is that people may tend to think that clinical psychologists can dispense medicine like
Ah,
psychiatrists
okay,
do.
that's
Yeah.
another point.
Yes.
True. So out of the 4 professions, only psychiatrists are allowed to prescribe medications. The prescription right is only to medical doctors. So even medical general practitioners, they can prescribe psychiatric medications. So I thought it's a good thing to clarify also, because some people thought that only psychiatrists can prescribe psychiatric medication. Even pharmacists doesn't have a prescription right, which I think the pharmacy group are trying to fight for that right, because that also is something that applicable to other countries, that they do have the prescription right. But in Malaysia, only medical doctors are given the prescription right. So the other professions all cannot prescribe medication.
And also another thing that I would like to add in, especially because I think a lot of confusion arises from the difference between psychiatrists, clinical psychologists, and counselor and social work as well. I think it's also how the difference between how a clinical psychologist sees mental health disorders compared to a psychiatrist in terms of the biopsychosocial-spiritual model. I think that's also a very big thing that separates the two, right?
Yeah, so I think, but to say that they don't see it from the other angle is also not fair, because it depends on the discipline of their training. The universities, at least from the one that I got exposure to, which is UKM, they do train the psychiatrists with both, not just the medication-related matters, but also psychological intervention. So sometimes people thought that psychiatrists cannot carry out intervention, which is not right. Actually, most training is supposed to cover that element. It's just that they normally see patients for 5 minutes and they need to rush to another patient for prescription of medications part. They don't ended up having adequate time. But I do know some psychiatrists, they do dedicate the time to do intervention. But to say who are stronger, I think it would be still the CP, because you can see the proportionate of training is quite stronger in terms of the CP's training compared to the one in psychiatrists, because their main focus still come back to the medical lens of looking into the issues and all. They would see it from a biological angle, but that doesn't mean they overlook the other angle. They do actually still cover the other angles. They still use a 4P system like how we use it also to look through the cases.
I think another interesting way to also see the difference between the three, so maybe can you give us an example of how these 3 different fields work together? Because I think a lot of people are also like, oh, if you go to this one, you stick to this one, you don't do this, and you know. But at the end of the day, each of these fields have specific roles in their specialization, right?
Yeah.
So how do they, in a perfect world, how would they work together?
Yeah. So I think it comes back to the severity of the issues, as I mentioned earlier. If the person already lost their functioning, so functioning can refer to daily functioning, whether you remember to eat, whether you can sleep, whether you can take good care of your own hygiene, or go through your daily life as how you're supposed to. If you are studying, are you able to study, attend the classes? Working, can you attend the work accordingly, complete your tasks? So those things are key factors to determine if you're supposed to see a clinical psychologist or counselor. If you are already at the verge of you can't really do all these things that I mentioned earlier, then I suggest clinical psychologist. But if you think you can still manage, it is stressful, it is challenging, but not as like you feel like you lost control, you can't do much, then I think counselors is a good one to start with. Because these 2 professions, again, because sometimes people have the stigma towards medication, and they have the perception that as if once they start the medication, they forever need to take the medication. These 2 professions doesn't prescribe medication, so it's a safe starting for you to go through to receive the services. And of course, it is always working together where when the one with a more severe issues will go to clinical psychologists. Once their conditions subside, become more normal, it's okay for them to transfer the case to counselors to manage. Same goes to sometimes the counselors try their very best to manage the case, but maybe the conditions of the client is more severe with a lot of challenges happening to the clients. The issues got more severe, the symptom got more severe. They have to also refer the case to clinical psychologists to manage. So this is actually how they work together. And the important thing when it comes to referral, when will they need to see psychiatrists, is normally on the judgment whether this case, is it sufficient to manage just using psychological counseling intervention, or does it need biological intervention, which involve medications. And sometimes, like I said, it involves other physical examination as well, the checkup, to rule out maybe possible medical related issues that causing them to have this emotional related issues. Then at least we know how to holistically managing all this. There are clients who see all these 3 professions all at the same time, inclusive even the social workers that we mentioned, because like I say, the 3 professions that I mentioned earlier doesn't provide monetary aids. the social workers is not them providing, but at least through their NGOs or through the government funding, they are providing this part, which is not covered, by the other professions. So that is another way that they get contributed and can get assistance to help out all these three. And when they are working together, actually this profession need to have a constant communication, of course with the consent of the client, and they need to actually communicate. So they have done this part, then the psychiatrist maybe will check with the CP, do you think that the client conditions has improved? Did the sleep issues got improved? Do I need to increase the dosage? All these things are supposedly in a holistic communications among each other to manage the case better. So that is actually something that support what we call as a multidisciplinary team in helping the client. If we are in a hospital setting, you can see that even more obvious how they work more like together compared to if you are in a private center kind of setting, because private centers normally psychiatrists are not there, so you have lesser opportunity to see how the whole team actually work very well together. But even with that, I don't want to limit that. We do actually call to some psychiatrists whom we know is co-managing this client, and of course with the consent of the client, like I mentioned earlier, and discuss. I received this case also. They are saying that they are seeing you. Can I check? Did they come and see you to take the medication? Because we can't trust the client fully. Also, sometimes they claim that they have come, but when you notice it doesn't seem right, then you can actually have that clarification with another profession also. Because the main aim is that we want to hope that we can help the client the best way possible.
Yeah, I think it even gave me a really better picture of how all these professions work together. So I think, like Dr. Shan said earlier, it's a very much multidisciplinary approach. Yeah. So, and also I guess to sort of summarize what Dr. Shan told us about what are the differences between these 3-4 fields, right? I think, well, number one is to make sure that we have the right qualifications. Where counselling, you don't necessarily need a bachelor's of psychology degree. I even personally know a lot of people also who came from architecture,
engineering, finance,
yeah.
accounting.
Yeah.
Really, I mean, I personally, I am also having a master in counseling psychology. So my classmates even have soldiers.
Wow.
You can see it's really like all areas. But the thing is, sometimes why the counseling profession can attract them and why they don't have a field limitation is because they realize sometimes it is the life experience that the person have make them even more suitable than learning just the skills in managing some non-clinical related kind of issues.
Yeah, that's really interesting to hear. Yeah, so aside from counseling, again, there is clinical psychology, where you do need a base of bachelor's of psychology degree and at least a master's in clinical psychology. And then there is psychiatry, which is on a more medical lens, where you need a actual medical degree and then you specialize in psychiatry. And social work, where sorry, you only require a bachelor's in social work, right?
But like I say, in the hiring of the social welfare department, they may not even need a bachelor to begin with.
Right.
Very rarely the workers there has a bachelor of social work.
Right. Okay. Right. And especially in terms of the roles as well, I think that's where we greatly differ, but also know that there is a lot of overlap. Yeah.
Should we move on?
To the next section.
And I think now we can move on to the next session. So that session is more to just understand what the difference is between the 3-4 fields, because again, it can be very confusing.
Yep.
So now kind of diving back into clinical psychology and more specifically what clinical psychology is, right? Just like you mentioned, like how the role of a clinical psychology is to provide psychological interventions as well as assessments, and they can do this at a capacity higher than a counselor could, and they can also diagnose the client. But what are the other kind of like different responsibilities that a clinical psychologist has?
I think other than the one that I mentioned earlier, some other roles that I see which are important is coming from the scientists, scientist practitioners advocacy model. I believe this thing you're already quite tired of hearing since I keep on mentioning in class, but I really want to remind that this is actually a very updated and latest model that the clinical psychology field are using worldwide. And a lot of time, at least because we all know how clinical psychology or even psychology is still in its infancy stage in Malaysia. We are not as established even to our neighboring country like Philippines. They have a way stronger APA-like kind of associations there. and all their professions are well regulated and all, which is way stronger. I'm impressed when I attend the conference and all that. I mean, Malaysia still have a long way to go to reach that steps, but we are working towards that. And one of the important part is to uphold the scientist practitioners model. Malaysians clinical psychology field always focusing on practitioners model a lot, which is training you how to become a practitioner, to see clients, to treat clients and all. But we overlook another very important point, which is scientists. Which is a researcher part, because our profession uphold evidence-based practice. We don't practice because we feel how it's supposed to be treated, then we only use our own intuitions or our own feeling as a guide. We are based on research to support the training, to support the education, to support the treatment or assessment that we are offering to clients. So all those things supposed to be able to go through scientific challenge, to check its reliability, its credibility and all that. And scientist part is, like I mentioned, the one that is so overlooked by a lot of the training. Even when we emphasize the importance of research, a lot of people treat it as, oh, I just need to have it pass. I don't want to focus that so much. I don't really enjoy research or like research. I mean, it's a dry thing. I don't admit that it's a dry thing. But if you don't see the deeper meaning of it, how it can influence even the practices that you're going to carry out, then you're missing out a very important part of the profession, which is the evidence-based practices that we have been claiming. If everyone only do the practices, where is the evidence-based thing going to come from? There must be people who need to dedicate their time to work on the evidence-based part, which is from the scientist role. And of course, I want to link the scientist role to also teaching related, educator, because the very sad thing is that even based on the latest release program standard from Malaysia's Allied Health Profession Council, it has indicated very clearly that the lecturers supposed to have certain years of experience after their masters, and of course, most importantly, they also look into the person supposed to have a doctorate degree. It can be a PhD, it can be the DClin side, the more industrial-based kind of doctorate. But whichever, I mean, it's understandable also because the minimum requirement to become a clinical psychologist is master level, right? And imagine everyone who teach you is still just master level themselves. It doesn't justify why they maybe are that qualified to become your lecturers. And of course, like I say, we also have like the allowance where some percentage of the program can be taught by master level, but they need to have a minimum of 2 to 4 years, for example, depending on which program standard that we are referring to. But there are still that line to guide that. But they didn't say 100% of the program can be taught by just master level. So that is another part that sadly I don't see so many people go into that level. Even if we are talking from Taylor's program alone, I don't have any PhD student that are from our own student going to PhD program. I'm not saying they must do it in Taylor's, but even when they are furthering their study overseas also is considered they are pursuing PhD, but we don't even have that. So you can see that I still need to vouch a lot more in classes to make people see the importance and doing that part. And then another area is also heavily overlooked is the advocacy part. It's like if you see a client with a social injustice related issues, and you know that why they got into depressions or anxiety, it was because how the system has failed them. Okay, but if you can actually make a voice to change the system, you don't need to see each client one by one in a therapy room. The advocacy part is something that a lot of people overlook and didn't see its significance. If someone were to actually be able to recommend to the parliament, because you need to know that when they are making any policy or any act and all that, they're supposed to have the usual research procedure as well, focus group discussion, they invite all the experts to have a communication, the experts are the one who craft up the policy and whatsoever. So those part is where clinical psychologists need to actually play another more important role to involve themselves into it. Or as simple as advocacy can be just sharing their view in media. The media loves to invite very odd people sometimes. So imagine if CPs don't go in there and voice their actual opinion. Sometimes even as, if you all recall earlier on, committing suicide in Malaysia is criminal, right? But because of people from the mental health voice that out enough, they are now decriminalizing suicidal behavior. So all this thing doesn't come in one day. And it doesn't come if no one else chooses to voice that out. So this is the part that I hope future clinical psychologists can play more role in advocating. I mean, you don't even need to start a super strong voice to begin with. At least you start something, hopefully the impact will carry, and hopefully the role will go bigger and impactful, impacting more people from then on. And of course, hopefully, like I say, you don't just help one client through the 1 hour sessions. The work that you do in advocacy could have helped even bigger population. They don't ended up becoming client to see you instead.
And I think that's great that you brought up the scientific practitioner advocacy model, because I think a lot of people think like clinical psychology is just the practitioner part and like
Practitioners
what
only,
they do in the clinics and all that. However, I think from there you can kind of understand the big influence that a clinical psychologist can actually have, and also highlighting how the interventions are actually scientifically based. So there is evidence that these interventions are there to help people out as well. And then when you bring up the advocacy part about the bigger image of the impacts again of what a clinical psychologist do to help society as a whole, and not just for one client, but the changes. And especially very interesting when you brought up the suicide in Malaysia and how it used to be criminalized. I think that's a really great example, and I think a lot of our viewers as well over here can kind of see a bigger image of how important it is for clinical psychologists to look at things in a holistic manner and all the different roles that they might not realize. I think that's a great kind of description of all the other different responsibilities. And you also mentioned a lot about like the assessments and these kind of things what clinical psychologists do, right? However, do you want to maybe educate what exactly are psychological assessments and what they're for, what do they do, and what they can actually do to help people?
Okay, I need to recall from the definition of psychological assessment that I think in general it's normally a set of questions that is developed in a standardized manner that they went through, of course, reliability, validity to check its suitability, and it has to be measuring what we intended to measure. And when they add with a term psychological in front, it means it's measuring things relating to psychology. So it can be behavior, it can be emotions, it can be disorder, it can be attitude. So it covers a big range of psychological related concepts when it comes to psychological assessment. So the common term that people I think more familiar with is questionnaire, battery, instruments, tools, scale. Those are the inventory. Those are the common names that you may hear when they are telling you this is the test that they want to carry out.
And maybe for like the general public here, when they walk in, of course, and maybe when they hear this word assessments, what are the biggest benefits of doing a psychological assessment?
I think the general very big one is understanding themselves when they carry out the assessment, because sometimes we thought we know ourselves adequately. We may not really know that well of ourselves. And I'm aware also that how the public may have a lot of access to free versions, but if they are not equipped with the adequate knowledge, even for you all, sometimes you can't differentiate so well unless you really do a lot of background checking of the assessment. Then only you know that the assessment is trustable or reliable or valid to be used and whatnot. So I think this is the part that is important for them to understand, that we want to use the tools to help them to understand themselves better, but don't use the wrong one.
Yes. Yeah, so basically assessments, as Dr. Shan said, can help us understand ourselves better, and also it also plays a very big part in diagnosis, right? Another big role in our job. And I think assessments, it also helps out with therapy as well.
To monitor the effectiveness of the therapy.
Yes, and since we brought up therapy as well, could you maybe also tell us what does therapy actually look like in practice? Not the idealized version that people see online or in social media, but what actually goes on in therapy?
Okay, maybe I think I at least need to start with what are not considered therapy in the first place.
Yes.
Because I think since you mentioned about how the media or maybe the TV have shown different versions of what is considered therapy, so a lot of people have that expectation that is how it looks like. One of the very clear one that I wanted to highlight is that we don't use the clock to swing in front of others to do what they claim as hypnosis. That is not a legit or even reliable therapy in the first place. So in clinical psychology training, we have a few range of approaches that we cover. The most popular one is actually cognitive behavior therapy, which has the highest evidence-based support. But of course, we have other evidence-based support coming right next to it, like for example, acceptance commitment therapy, dialectical behavior therapy. So those approaches also are catching up. to actually raise more appearance and awareness. So what happened in the therapy, if you want to simplify, is conversations. We call that TED Talk therapy. They have conversations from one to another, but in general, they are trained with different approaches with a different set of skills that is going to guide the persons to be able to share what exactly happened in their life, and from the very strategic way of them crafting their sentence, their questions, they will make you feel that you are being understood. They will make you feel that you are being empathized in that process. They will make you feel heard. And of course, in a bigger picture, in a higher level also, they will make you feel like your issues are being analyzed. Because I think that is another part that sometimes they don't quite see, how does it differentiate from a normal conversation that they have. But because the clinical psychologists are trained with that sets of different approaches, it can help the people feel that how their issues become clearer to them. They have maybe better clarity how to work around that, or maybe do certain actions to change certain things. Some approaches, they have homework. So if the therapy doesn't only happen within a session, it also happens outside of the sessions room. Some approaches, they don't have homework, but they have other ways that make this therapy effect still carry out outside of the therapy room. So that is generally what happened in the therapy room.
So in general, like in the therapy room, I think the main theme that you also brought up is a lot of insight, and
Yeah.
especially when you mentioned like how a lot of times we think we know how we're feeling or how we're doing, but a lot of times we actually don't, because in a way, I guess when you can like look at it, maybe just like a little analogy that I like to use, like you know those cartoon characters when there's squiggly lines everywhere, therapist kind of helps straightening it out, right? Would you agree with that? Yeah. I think that's a great
Or
way
how
to
to
see it.
organize it to
Yeah.
become clearer, and you feel not as clouded to you to look
Yeah.
into. Or you know, when you are seeing everything as dark, the clinical psychologist can help you to see there's some light.
Yeah.
You know, in that scenarios that you thought is completely hopeless.
And another thing I think that's really important that you brought up are the different approaches. Because I think a lot of times also people think that a clinical psychologist or therapist, you just like talk therapy, which is a form of therapy. However, there's so many different kind of approaches that you use, and
Inclusive some expressive art related, experiential related therapy that involve arts, involve centre. Those things are also part of the strategy or treatment that we use.
right. And I think that's also beautiful because a therapist can really tailor an intervention to the needs and what the client then and their needs for them to help them to support them as well, which is definitely something that maybe can also educate yourself a little bit more about, just searching up, I think, therapeutic approaches. We wish that we can cover everything here, but then of course that would be too long. But I think that might give a bigger understanding of really the influence and the impact that a therapist can have on the client, and how tailored that the interventions can be. And it's not just talk therapy, it goes so much deeper and beyond that as well.
Yeah.
Yeah.
So I think if we are suggesting to the clients how do they identify who will be a suitable clinical psychologist for them, it's important that they check like what are the approaches that the clinical psychologists are more familiar with, and they can do a simple search to understand that approach, and then see whether that align with their preference, their values, or their way of working. Then they will know that whether this may be a good match for them or not.
Yeah. So, I guess in terms of clinical psychology, you know, aside from doing assessments, diagnosis, therapy work, of course, and you know, also being able to become a researcher, I think another thing that is also coming up these days is that clinical psychologists can also work in corporate a lot, like EAPs, right? Yeah. Could you maybe tell us a little bit more about that?
Yeah, I don't know how should I describe this when I hear this one coming from your side, because it's since the beginning of our interview even, you know, the question that you asked happened to be all the life experience that I went through myself, because I happen to be a counselor myself. I happen to also have my internship in social welfare department during my counseling program, and the one that you just asked about employee assistant program, that was my first job when I graduated from my first master. So I was employed as an employee assistant program executive to handle that. I wouldn't say I have a super detailed experience, because I only worked there for 7 months, if I'm not wrong. And then I already started my second master's that time. So I can only share based on that limited timeline I have. So for employee assistant program, it's actually a benefit that given by the employer to the employee, where the employer are funding some percentage of the sessions. So it depends on different company policy. Normally, the minimum package that we will recommend is at least 3 sessions for the entire year for the employee. So the employee can actually request to see psychiatrists, not psychiatrists, counselors or clinical psychologists in a private center, and then with a contract signed where they can receive the services from them maximum 3 or 5 times. The more recommended version is 5 sessions the whole year, and then of course it's renewable the following year. So they would get this support in order to ensure that the employee get adequate mental health support funding by the company. Some company maybe they don't opt for package, they opt for maybe percentage. So for example, maybe 50% of the session is covered by the company, but another 50% has to be paid by the employee. So it depends on that different contract and whatnot. But for companies who are open for this EAP program, it is actually a very good, and it shows also the company is compassionate, they care about the employee, and that attract employee to want to come also to join, because it shows that they care, right, about the employee. So sometimes some companies see as, why do I need to waste that amount? It's nothing to do with work. But what they overlook is that even absenteeism, lateness at work, low productivity, a lot of time is not really the attitude of the respective employee. It is actually a sign of mental health challenges that they are facing. Not necessarily clinical issues, but it can be some disturbance happening in their life. I still remember one of the things shared by my superior that time was that there is a very high performing HR that was working in a company, has been performing super well for 30 years more or something, like a really long working experience and all that, but she was hit with some personal issues that time that is causing a lot of impact towards the person's life. And because the person as a HR, they know about these EAP services, so they opt for that services to try to talk about their own issues. And after the sessions ended, of course not one session, several sessions, the person managed to recover in a way from the issues that they are facing and function even better as the HR executive. Imagine if they don't get this support. We lose a staff who have been so great. And the retraining cost is even higher. A lot of the company fail to realize that they thought, we can just hire someone new. But what you don't realize is that sometimes you need all these people who are already knowing the history of the company and all that to continue stay in the company. And this is where I see how EAP is really contributing really well on supporting this part, because you never know, one day your staff need that. And don't stigmatizing them by saying that when they need that means they are weak and whatnot. The courage to talk to a stranger is not easy. They are very courageous to open up and willing to deal with their issues and talk it out and try to resolve it. So I would see that as a very courageous act if they are willing to seek help through this channel.
And it's also really great that you also kind of went through as well the influence that seeing a therapist or even a counselor can have on an individual on work performance. Is also very important to note as well that this also applies to students or just anyone in general. It can help you function better in your day-to-day skills, activities, and all these things, even like sports psychology as well, and like athletes and all that. So there's a big influence of that as well. And I think also we're touching a little bit of career as well, especially for those that are considering taking clinical psychology. What are the different career paths that clinical psychology can take, and about like which settings can they work in, and these kind of questions.
Career path part, you are saying what educations or what?
More like career path, like after they graduate from master's or clinical psychology.
Okay.
What kind of career paths can they think, or should they be thinking about?
Yeah, of course the most popular one is hospital, but normally hospital will require them to have a minimum 3 to 5 years to be hired. But it's not too long. Just stay there. Sometime in the field, it's not difficult to reach that 3 to 5 years after some time. But that one applies to private hospitals. But you must know that we also have the government hospital that is actually eagerly looking for adequate people to join. It's just that I think a lot of time people are concerned about the salary offered. It's especially if they're coming from, for example, the two of you, if you're coming from a private university's program, you would feel like you already spent so much in the program per se to some extent, and it may not justify to you if you need to only get that amount of salary. I think it's even inclusive of all the allowance is roughly 3K. They may have some adjustment of salary, but it's not as big change and whatnot. So there will be people who find that not justifiable. But of course, you need to also know that sometimes you need to go through that process in the government hospital training. To serve as a full-time there, to really pick up the skills there, exposure there, and like what we love to say, berkhidmat for Malaysia, really contribute your contributions to really work for Malaysia. If no one wants to do that, who will be the one who, receive that benefit and all that? And of course, being a government servant, there were a lot more benefit that you don't get from there, and a lot of training opportunities also funded, by the government. That's how they compensate, maybe in a way, for the salary part that they can offer. So that is one area. Other than hospital setting, private center is another popular options. A lot of private centers are, allowing people to become a clinical psychologist there, but full-time position is always not as many. But I do notice that a lot of time, a lot of clinical psychologist graduates are not interested to take a full-time position as well, because full-time position means they have to stay there to, from certain time to certain time every day, clock in, clock out kind of thing to get their salary. So they would prefer what we call as associate scheme, where you only go in there when they call you for sessions. But you need to also know that when client cancel the appointment, you go there for nothing, but you don't get paid lah. So that's how unstable it is. And of course, after some time, you all may notice that there are some peak season, there are some low season also. So your salary will become so unstable, which is why another area of job that I saw some clinical psychology graduates now do is to teach part-time. Because, teaching is a more stable income. That also is something that some clinical psychology graduates were to do, because if it's master level, you are qualified to teach for bachelor program. And of course, once you reach 4 years, you can also teach part-time for master program. So that's how another route to get the income. And of course, along the way, also company is another option. But so far, I don't think I hear any, like in a very popular manner, where a lot of companies are hiring full-time clinical psychologists. In the past, there is at least sometime have this history before, but I don't think it's as common now. There are some company, it's like a multinational kind of company, they may have that position, but you can see that position is open to the whole world. So the competition is very high, but it's not impossible. And of course, you will notice that some private centers, they offer EAP services. That is another way to keep their finances a bit more stable through those initiatives. Some school or university, they do offer positions to clinical psychologists. Some universities, their counselling services are not just counselling, they do hire clinical psychologists, because they realize sometimes the student issue are not non-clinical already. They need the clinical psychologist to chip in to handle a more severe level of issues. So they also do hire that. Some school, they also realize the importance of CP, so they do start to offer that position. Not a lot, but it's a trend that start growing, which is still a good thing rather than nothing. And of course, even some of our seniors, your seniors, they already open up their own center. So that becoming an entrepreneur is also another pathway that they can go through. You don't have to just passively waiting for a job to come to you. So these are a few of the options that can be considered. So far, I don't think I know any other way, how other setting they can go to. Of course, if you want to consider a full-time academia options, you have to really seriously think about taking PhD or doctorate program. Then I think that will help them to eventually become a lecturers, researcher, teaching, and all that. So that is another path that clinical psychology graduates can go into, because you are already just one level left. Might as well just complete that doctorate actually.
Yeah, so there's actually a lot of things that you can do with the Masters of Clinical Psychology degree. We're actually very, very versatile, I would say. Yeah.
I also like to add, and I think also to highlight as well, that you can also be like, a therapist or psychologist that's more specialized for like adults, adolescents, and also children as well. Like another one.
There's no specializations in Malaysia, so we can't claim that so-called specialized. But you can claim that these are the population that you see more, but specialization is still not something allowed in the program standard, so we don't have specialization.
All right, so no specializations. However, you have like a target depending on where you work at.
But of course, you can also say like you have this additional training on top of the master program, because our master of clinical psychology program is standardized by our program standard, where we must train people as a generalist. It's like a GP training. We cover all disorders. But to claim that you are specialized in this area, so far no program is offering that or allowed to offer that.
Okay, so I think that was very informative of what we can do. So now we would like to move on to our next segment for our remaining half an hour or so. Yeah, so I think this I'm very personally interested in as well. So right now we would like to go into a little bit more about what do Masters of Clinical Psychology programs actually look for in candidates. I think these are like very, very burning questions for those who want to apply, or maybe even those who are just, you know, interested to know, like, is clinical psychology for me? Should I go into it? Okay, yeah. So, and I think we have a very, very suitable guest lecturer, with us here today, because Dr. Shan is our dear program director. So she will know a lot about what are we actually looking for. Yeah. So
I think I will start as simple as communication skills.
yes.
The very sad thing is that when we are interviewing the students, which is why interview is one of the important criterion that we look into when we are taking students into the program. But sometimes you are surprised that the candidate can't even speak. And okay, the main conversations that we have is in English, right? But even a very simple wording to express their thoughts and all that, the persons are stuck or overly nervous that can't really utter certain sentences that make sense. So if you are that level, imagine you are going to see clients who with clinical disorders. They are going to be quite difficult to manage, and you get nervous up to that level that you can't speak. How would that show us that you are a qualified or suitable candidate to take the program? And of course, another thing, because it's always very limited seats, we definitely look into the CGPA requirement. And for me myself, another thing that I look into in the person's transcript is the abnormal psychology results. If they are already getting C or even D there, even though maybe they still pass the whole bachelor program and whatnot, but the whole clinical psychology program is a bigger version of abnormal psychology. If you can't even pass that one general module during your bachelor, how does it convince us that you are going to be able to survive in a way in the program? So that is something that I look into when it comes to that matters. Some other areas would be more to attitude, the willingness to learn. So I think this one is a bit vague, that's why we need to judge it through interview. Because the very sad thing is that sometimes we have people who come in thinking that they know everything already. But if you are holding that, how are you going to absorb the knowledge that will be delivered to you? Of course, I'm not denying the previous whatever experience or learning that you have are invalid. But that doesn't mean you really know what it takes or what's supposed to be understand in the field of clinical psychology. If you were to really know up to that level, you may not need to join the program, right? So I think it's the openness to absorb the knowledge and all that. Another area that I would say, if you keep on remembering what I said in the beginning, we need a bachelor of degree as the foundations. The very surprising thing is that when we are asking knowledge that's supposed to be at least remember, not like we need details, specific wording, that kind of thing. We are not doing exam, but you can't even answer that simple knowledge about what we ask you about, the bachelor psychology knowledge. Then it's a bit hard for us to know that whether you will be able to take in the intermediate level in a master. You all went through some modules already. Even if we want, we can't always teach everything from scratch. How long will it take? Especially it will make the other students who already have those knowledge feel like this class is so boring. Those things I already know. Why I need to learn again per se? But there are another group of students who already really got very poor basics, or they don't even put in the effort to go and restudy what they have learned before. Then how are they going to be ready to join the program? So to me, these are the most important things as a whole that we look into. And if those things are not there, it's going to be very challenging for the person to get used to the program, because we don't want to take in students and then seeing them needing to leave the program, due to the reason that we explained earlier. Because then it also tells that we failed in screening them during the interview itself. So those are the things that we look into. And of course, I think in the end of the day, it comes back to the passions of the field. The another very sad thing is that, I come here because everyone else of my cohort also choose clinical psychology, or my parents make me come. At master level, you still only trust your parents' judgment and not really coming from your side. So that is another sad thing that we don't want this type of candidate. We really hope that you carefully thought of it. If it's not, don't waste everyone's time by going through the whole application, because if you recall, the application process needs so many documents already.
Yes.
If you were to go through that, make sure you really are passionate into it. And I think another thing that we look into that will become an advantage, which we clearly stated that out also in the entry requirement, which is the working experience. Sometimes another very sad thing is that they come into the program, they get exposed to real clients and all that. Oh, I didn't expect this is how it would be. And then they got shocked, and then they're scared. It's just like, medical program. People didn't know that they need to see blood. Then when they saw that they need to work with blood, they can't take it and they have to leave the program due to that. So same things to clinical psychologists. Sometimes when you definitely won't have the actual experience like you work as a CP, because you are not allowed yet. But at least, working in relevant field, knowing how CP works, give you some exposures, make yourself more ready to face that kind of clients. Then at least you really will be able to adjust in the field.
You gave a very amazing answer because you actually checked out all the boxes of questions we wanted to ask in a really nice summarized way as well, about what you're looking for. Communication is a big one, as well as that desire.
Because you see, we need to use talk therapy, right?
Yeah.
If communication is also not meeting, I really don't know how to really help those candidates.
Yeah. The other things as well that you look into, passion, that willingness to learn, as well as also knowing the basics, which is very insightful as well, how the selection process and what you really look into as well, right?
Yeah, and I think that can help with in terms of interview preparations. Yeah, so these are tips, make sure that you know your stuff, do a little bit of revision before you go into your interview. Yeah, and I think other qualities that are really important.
I think on top of that, I want to just add something, since we are giving
Yes.
people tips, and if people are willing to listen to our podcast to get these tips, I hope they at least hear this. Please wear formal. This is another very sad thing that I didn't know I need to remind. I didn't know that I need to tell. There are people who really wear t-shirt, pajamas to the interview. I really don't know, are you really serious in coming to the program? And there's no reason why they're wearing that also. Maybe sometimes it could be, I am my house got flooded, I really got no attire to wear, that's why I need to wear this. At least those kind of reason to justify, no reason. It was simply overlooked that they think coming to an interview they can just wear as casual as it is. I don't think you even see the severity or maybe the seriousness, the importance of this interview, and you are not even dressing in a way that you respect yourself, you respect the interviewers. So I hope whomever who are listening to the podcast will at least please wear formal attire.
Make sure you dress up like us while you're doing the interview, yeah. I think also another question that might be also very beneficial to people watching as well is, what are some self-reflection questions that they can ask themselves to see if this is really something they want to do, or they have the qualities, or they're able to do this course?
Yeah, I think one important thing is that when they hear about the clients who have this psychological disorder, whether they themselves feel for them or not. If they are seeing them from, scary, or dangerous, then I don't think this profession is for you. And I think some other questions would be, it is going to be a very daunting, tiring. I think a lot of our students also sometimes will feel like they are burning out. The thing is one after another, non-stop. Even I want to claim that even is after the program itself, when we are working also, regardless of the setting that we are working with, because I have other colleagues from other places, right? It's all the same. We always have things non-stop, one after another, regardless of the area or settings that we work into. So if you want a more relaxed career, this is not the career that you can go into. You need to be prepared that because we are managing a more severe cases, sometimes another very sad thing is that the client is not adherent to the medication. They doesn't react to the medications. These are the rejected case in a way by psychiatry. They will send to us. We are the one who handle even more difficult cases that sometimes psychiatrists also find that they don't want to manage. That's why they are referring those cases to us. If you know that these are the people that you need to deal with most of the time in future, are you willing to dedicate, if you are seeing this as your lifetime professions, to it? Because if you hear any of it and you are already hesitating, then I don't think this field is suitable, because it takes a lot of passions, a lot of enthusiasm to the field that you genuinely wanting to help to actually come into the field. But another area that I want to highlight also, I hope whomever the person who are applying the program doesn't apply that because of unfinished business. Sometimes another very sad thing that we hear is actually the area where, oh, I have these people who are in my life, maybe they committed suicide, and which is why I want to dedicate my life now to help them. If they don't resolve this unfinished business and join the program, they will end up burn out even faster than other people. So these are some areas that is important to be clear out, because if not, you will end up quite affected by whatever things in the past than really be able to focus on your present.
And it's also, very important to also for people to understand that the true realities of what it takes to be a therapist. Because I think a lot of people overlook that, like, you just graduate and you're like, oh, where should I go next?
This is some comparison that I love to share if people were to ask me for my personal opinion. We have, in the program that I studied last time, we have counselling psychology masters, which I myself went through. Then I took master of clinical psychology, but I have friends who take like master in IO, industrial and organizational psychology. I have friends who also took like master of developmental psychology. Not my friends, but I know some other people took like master of social psychology. Those are more research-based kind of module. When I'm taking just the counseling psychology itself, I thought like, why my life and my friend's life is so different compared to the one who are taking IO or developmental or social. They are like so free, and they are not like as stressful as we are. We need to do verbatim, list down the whole conversations and all. We need to really do a lot of thorough work, a lot of preparations and all that to see clients and all. And I thought, I have went through one master's. It's already hard enough in my view. I cried during that time some more in a few of the experience there. And I thought I would be more ready to take another master's in clinical psychology. I was wrong. The difficulty level is way worse than even a counseling program. So, I mean, I went through 2 masters myself. If I want to express to others, how the difficulty level looks like, this is how it would look like in the professions that these are the common options by people who pursue Bachelor of Psychology. If they want to pursue, they need to know that. But I don't want to say that in a way that degrade other professions. It's just that other professions have different expectation and requirement. They of course have their difficult part, but it's not as taxing, I would say, compared to the thing that we need to cram in. But one thing that I think I want to highlight also is because our Master of Clinical Psychology program, it is 2 years program. And in other universities, other countries, for example, US and UK, it is a doctorate program. So they normally need to go through another 5 to 7 years to train them for the same content that we need to cram in 2 years. So it's understandable why our content is so much more taxing and so much more heavier. And if we don't tell that ahead of time, people would think like, how come we make the program so, so many things together? But that is the content that we must cover within the training. So that's why, the history of Malaysia, we accept up to master level. We didn't upgrade it to doctorate level. That is the basis that I need to tell. If not, people would think that, how come just master, they need to do so much? It's because of that.
Yeah, so I think to sum it up, you really need a lot of passion, a lot of resilience to really persist through the course. And as Dr. Shan said, I guess to be very frank, Masters of Clinical Psychology is not exactly the easiest. We have a lot of things to juggle. That is, our lectures, our
You are
tutorials.
doing the top courses at the same time, seeing clients.
Yeah, seeing clients, and sometimes we do like outreach work as well. Yeah,
You still need to see people during weekend, right?
Yes, yeah. So it is quite challenging, but I think another thing that we also want to tap into also, right? Like aside from the academic challenges, we also want to know a little bit more about how is it actually like emotionally, or how does really like going through Masters of Clinical Psychology actually like, because in terms of, I guess, the emotional and personal challenges that you go through?
I think maybe from the Master of Clinical Psychology, it starts from I didn't get even an interview opportunity to begin with when I applied that during the last semester of my bachelor program. And then that time I thought, could it be because my CGPA is not first class? because the competition is even way less. It's only 2 universities offering the program that time. So that time I was judging myself, did I not do good enough to get even the first class result to get a chance to be interviewed. But I later found out it was not that. It was just because they only process the application that has the full transcript. So if it's still like the last semester, which to them is you haven't completed your program, you can't apply. So they won't process your application. But I knew it after that. So that time, because I don't get that, so I took another master's because the two fields to me is quite similar regardless. So I thought maybe I can still give myself another try. And that time I also have the plan. I want to use my master's result to impress them because I couldn't change my result for my bachelor already. So I make sure my first master got first class. I got 3.83 that time. My bachelor was not too bad, it's 3.56, but still not the first class results, you know. So I intentionally used my first master's also to boost up the chance of me, but later on I know it was not needed. But regardless how, I think all these things still prepare me in a different way to become a CP. I think when I studied the program, like I said, it's a 2-year program. It was really taxing because they only offered full-time mode, so you really need to dedicate into the program. There's a lot of classes ongoing. It's a similar structure how we use in Taylor's as well. When we are in our second semester itself already, we need to start seeing clients. So, you know, we have class, right after class having to rush to the room and then see clients there. And when you see clients, you don't just go in, you know, you need a lot of preparations, you need to prepare the worksheet, sometimes you need to carry out certain assessment, you need to plan and all that. And it's the same thing like how you all faced last time also. We will have room issues, it's never adequate room, even they took so little students there, right? Room is still an issue, it's never enough because the client is a lot. I think it also comes with a lot of challenges when it comes to the heaviness of the program because it's just non-stop. We really don't have a breather in between. How to take good care of our own mental health while completing a program that we claim that we are going to help people with their mental health. I think it's something that makes the graduates resilient. Because if you yourself get, you know, disturbed or affected too much in whatever things that you go through during the program itself, that's the very sad thing. Because we do have other, you know, some of my seniors or even some of the other students that I see within the program, sometimes they get affected by, I cannot say that that issue is small. Because of course to them that issue is huge and difficult and big in their eyes. Sometimes it's a failure of a module. Sometimes it is personal issues like they break up. Sometimes it is something happened to them, their family member passed away, their close one, you know, parents and all that. They can get affected by that incident. I am not saying that is minor, it's still a very significant one, but they don't rebound. They don't come back, they don't have what we call as resilient, if you notice. And I realized, you know, in the end, the one who managed to complete the program, I wouldn't say they are the smartest, they are the most hardworking, but they are definitely the most persevere ones who managed to complete the program. Because like I said, it's already so many challenges earlier. I think that time during my year, we had 13 students, including of myself. Only 9 of us graduated. We set up a WhatsApp group called Survivors. Because it was so hard to go through all these things. The practicum side is limited. I think it's still the same issues even at these generations now. We have to fight to the practicum side, and we need to go through interviews. And even at that time, you know, because of the limitations, I mean, even right now, we are not allowed to choose. So when they assign, we have to just go. We can't go back and argue. And especially in government universities, somewhat, we don't have the culture. Everything we ended up must complain, must ended up, you know, argue back and all that. It was really different, I think, when it comes to other, you know, private settings and all that. So I think this is something that I felt I went through in a hard way. I think if I'm talking about modules wise, I didn't score very well in pharmacology angle, pharmacology modules, but adequate enough for me to just pass and graduate and all that. So I think it's not easy because, like I say, a lot of us got really good CGPA due to, you know, the challenges to come into the program, and everyone would think like, oh, I should be able to perform as well as I used to be, right? But what you overlook is that everyone out in this program are the elites. You are not competing in a pool of elites. You're used to be more elite compared to other bigger pool. you don't have that advantage anymore. So if you don't lower down and make yourself humble to accept that you may not be the best among the elite, I think that is a very big, mental preparation or changes that some people need to go through. If they can actually absorb the fact that I may not be the best, and that's fine. You don't really need to be the best in everything. I think that's where it's going to make the person become successful in the future. I just don't want, sometimes some people took like one challenges in their life or one thing happening in the program or whatsoever in their life and thinking that it's the end of their life. Or the another setting is that some people see as like, oh, I need to extend, especially if it's some modules failure kind of thing. But we have a lot of cases where some cases, because of the person persevere, they extend and they really perform way better because they go through another round to be retrained, to learn through the knowledges. They really perform better. Yes, it dragged a little bit of the time. I mean, some people maybe not a little bit is long enough in their duration, but that is only how many parts in your life itself. And sometimes that indication is telling you that maybe you need to really learn certain things that you didn't learn adequately, which is why it landed you into these certain results, right? Or maybe even certain life challenges that you have gone through. If you let that one incident affecting your future professions, it's not worth it actually. It's not easy to overcome. Sometimes that's why we have the option of asking the person to consider deferment, to take like one semester to rest first. When you're ready, you come in back. But sadly, some cases that we saw, like I say, it comes back to perseverance. If they don't come back, even though we encourage them, there's nothing much we can do. Sometimes that's the setting that sometimes the student may not know that we have offered adequate support as much. They would still see as not enough. But it comes back to the person. If the person is not the one who willing to step up the first step, to reach out for help, to even take in the support that we offered, that's where I see some really sad case when they face that in the program.
And I think that's that really explains just the challenges that you face as a clinical psychology trainee. And on top of that, it really reflects back on the values and why the values and qualities that an individual has is very important when it comes to taking this course, and when it comes to as well the real life, what happens after you take the course, right? Which is like the perseverance, the resilience, the
and
willpower.
it translates later on actually to the person's real life.
Yeah, exactly. And these are even more questions that the viewers can ask themselves as well. And this is the reality of it. And you can ask yourself, like, is this something that you're able to do as well, right? Which is very
you're
important.
willing to go through.
Yes, exactly. Yeah. And I think now we're coming towards the end of our podcast, so we do have some closing questions as well, and maybe like we can start off, right? Because you did mention a lot of like the challenges and what clinical psychology is and all these things. What is like a piece of advice that you would like to give the viewers?
I think when it comes to different viewers, because I think one would be students who really want to pursue the professions, I think it comes back to referring back to the reflective questions that we asked earlier would be something helpful for them to determine whether the field would be suitable to them. Sometimes it's okay that you don't like clinical psychology, because I think the very sad thing is that I think it's the over popular interest towards the field. People thought that if I am, getting good CGPAs and all that, I should do that. It's just like sometimes when people see that their children get good CGPA, you should be a doctor, you should become a lawyer. But that may not be their real interest. No, so I think it comes back to whether you are willing to really contribute in this field, and it's not just for the 2 years. You need to know that when you are in the professions, sometimes it is your lifetime, into that professions. We see how some of our very strong veteran clinical psychologists, they are still in the field when they are 70 plus, 80 plus. All these things show how dedicated they are, how passionate they are still in the field itself. So I think this is the questions that you need to ask yourself. Are you willing to deal with this part, handle all the things that come from this program itself? But all this training are necessary. It doesn't really design in a way to make your life difficult. If that is something that some people may have misunderstanding too. If we reduce the level of the training, how would that reflect later on when you are seeing clients? All those things are adequate skills that needed to be implemented in the program to help to train the persons in that way. So I think these are the important things to look into. And I wanted to highlight sometimes ethical is also a very important element. Some people love to take shortcuts. Some people love to take easier way and thinking that if I'm not get caught, I'm not unethical and whatnot. Or doing this, everyone else is also doing this is not doesn't mean like I'm also at wrong. If the person still carry this kind of concept and thinking that it's okay not to think ethically, then maybe you also need to reflect on this field is suitable for you or not. We are managing life and death issues. If we look very lightly about the ethical part, I don't think this is something that the field, these professions would welcome, unethical practices and all that. But of course, we won't be saying that we are so clean, like there's no unethical things at all, because sometimes ethics can be quite subjective to the defined. But if we don't actually hold that as a part of the person's principle and seeing that as something important, I don't think again this field would be something suitable. Because it comes back to why certain people are more suitable to do business, because these things to them are not important, which is fine, again, it's just different choices. And coming back to maybe clients who may see this podcast using a way to judge, all that. I hope today's podcast give you a view where you understand how clinical psychologists are so thoroughly, going through all this procedure to be trained. So don't easily buy in if someone were to tell you that they are considered psychologists or even therapists, or they use some really fancy words, soul maker, to make it sound so grand. If they claim that they are psychologists, they claim that they are counselors, there's always a legit platform that you can check through. If it is counselors, check on Board of Counselors Malaysia. If they are claiming themselves as clinical psychologists, they can refer to Malaysians Allied Health Professions Council to verify all this identity. So all these things are important things that I hope they go through and check. But even with that, I need to claim that sometimes that doesn't mean that all of them are equal in terms of their quality of the services that they produce, or even on the practices that they have done. So it's important that they don't get discouraged. If you don't get well with one counselors or psychologists, don't get discouraged thinking that there's nothing you can do for your life. Change another one. It's just like sometimes in the medical field, people will switch from one doctor to another and they get well after that, right? So don't let that one not performing as good doctors to affect your perceptions towards medical and thinking that you can't get healed. And sometimes I wouldn't blame it to the psychologists or counselors, because sometimes it's the aura, the connection, it just doesn't match. And that's fine, right? I mean, I don't think we need to push like every client will to like you, or all the therapists also will work for all clients. Sometimes it's good to test out, and maybe if it's not suitable, it's okay to change to another therapist to make sure you yourself get treated, get supported along the way that you find you need help. So I think this is the two messages that I wish to deliver today.
Yeah, thank you so much for that. I think that's a very good advice. But basically, you just have to do a lot of self-reflecting to really ask yourself, is this for me?
I think even in the program, we have a lot of reflective activity that you want to go through.
I think even until today, I'm still reflecting on myself. Yeah. So aside from only asking you, Dr. Shan, for advice, right? I think I also want to ask you, Hafiz, do you have any advice, for anyone who is thinking
will be
about
your
coming,
future juniors.
coming into clinical psychology?
You're putting me on the spot here. I think the advice really is actually like for everyone, the people that are considering clinical psychology, do your research. Because the things you see on social media, the things you see on television, movies, all the things that we see and absorb, that's not the reality. And like what you highlight as well, it is a very challenging field to get into. However, I think it's such a beautiful field where you're able to help people and make such a positive and great impact. So if that's something that you really want to do and you want to dedicate your time and studies and life to, then most definitely I think clinical psychology is a really great place to be in. Yeah. How about you, Sandra?
Yeah, honestly, I think my advice wouldn't be, as much different. Definitely really, really question yourself a lot. Take as much time as you need, because you would be committing to 2 years of a pretty tough program, right? So really ask yourself, is this for me? And I think aside from just asking yourself as well, I would really encourage people to actually explore, because I think one thing that I often hear also in other friends is that they're always like, I'm not too sure whether clinical psychology is for me. Am I more interested in other fields? So I think if you have that thought, right, I would highly encourage that you explore, the different interests that you have, because I think at the end of the day, after you have all these different interests, right, then you can sort of compare and see, okay, actually, I think after doing all of this, maybe clinical psychology is for me. And I think I say this from a very personal challenge that I have as well. You know, coming to the course, clinical psychology is not easy, and there are times where I was like, you know, would I have fared better if I went into this
Some
job?
other
This
field.
job? Yeah. And I think that's where I think a part of me wish that I would have maybe get a bit more experience. Yeah, just to know myself a little bit better. But not only that, the more experience you have, whether it be you go into clinical work, you will take something away. You will, you know, improve your communication skills. You'll become more resilient. Yeah, and I think that will really prepare you for the course way more. Yeah, and again, I cannot stress enough the importance of resilience. Yes, because it will be challenging. But one thing that I will say for sure is that you will really grow a lot. Yeah, because no matter how
Yeah, I
tough,
see how both of you grow a lot.
yeah, no matter how tough it has been, I would say that I am a very different person than when I entered the course. Yeah. So
I can vouch for that. I still remember the beginning until today.
oh, thank you.
But it's a good positive side of
Yes,
growth.
definitely.
And hopefully it'll keep growing as well. Yeah.
Yeah.
Is there anything else you want to add in?
No, I think
Okay. I think that wraps up our podcast for today. And of course, just before we wrap it up, we just want to let you know if you are looking for affordable therapeutic services, you may check out Heart Psychology Services here at Taylor's University, where we've got our trainees here, including Sandra and myself for this batch, if you're considering it, we will put the links and everything in the description below. And anything else you want to add in?
no, I think that's all.
Thank you so much for watching. Thank you so much for
Bye.
Dr. Shan as well for being here as well, our program director. So it's a really big privilege to have you here and very insightful. I think
I'm glad that I
yeah.
joined today.
we both learned a lot, I think,
Yeah.
especially with what it is, what clinical psychology is, and the course and everything. So thank you very much. Don't forget to like, comment, and subscribe. And we'll see you in the next one, whether it be us or the next batch. Yeah, our juniors. So yeah, thank you.
Thank you.